it's live.
Are we live? Oh,
yeah,
cool.
We're live. So we're super excited. We're getting started like right on time. So today we're always right on time. So today we are going to be going over how to master nursing school finals, and so you can be a little bit less stressed, not die, things like that. My name is Amber Brown. I'm the founder and CEO of Ivy League Tutoring, and I'm here today with...
My name is Jared Douglas.
Hello, Jared Douglas.
I am the critical care tutor, and I do all things critical care, all the questions, all the study guides, everything. I'm an ICU nurse in Memorial Hermann. Oh shit, I can't say that. Well,
Too late.
Too late. So we're going to talk about the study guides and how to pretty much stay calm and focus on what you need to get done for all of your studying and all your finals, and to keep on track and not watch Netflix 17 episodes in a row like I may have done once or twice.
Not every day, anyway. So nursing school finals are tough. We know that. We've had a lot of students that have come in looking little ragged, to be honest, and we're trying to prevent like Cushing-like syndrome and adrenal fatigue, things like that. So what we do know is that in nursing school, it is incredibly stressful, right? Oh, hey. Yeah, people are coming in. So when you come in, just let us know kind of where you're from, what nursing school you're from. And then we're going to do a Q&A at the end. So if you have any questions you want to ask us, now would be the time to kind of pop in. And then we'll answer all the questions at the end. So anyhow, bottom line is we've had a lot of students come in super stressed about nursing school and about finals. And they have come in and they're tired and they're fatigued and they're feeling like absolute kind of garbage. By the time you get to the end of the semester, you are worn out. So you have already had exams and you've gone through clinical and you've had all these different things that have really, really depleted you and caused you to really go into a chronic stress response. So if you know anything about chronic stress response and about the adrenal glands, and you know that the chronic stress response is not so good for your body, hypertension, hyperglycemia, if you've gained like 482 pounds in nursing school so far, which most people did,
Definitely.
That's probably the reason why. Okay, we got some people coming in. This is Steven. What does it say?
Wellington, Kansas. I'm going
Kansas.
to Butler Community College.
Awesome.
Hello, Stephen.
Yeah, welcome and join us. Feel free to ask us any questions. So our whole point today is to try to give you some tips and some tricks to make it through finals, get there without ruining your liver with alcohol. That's one big tip we're going to have a little chat about today. Talking about things that you can do to really master finals, keep your body healthy. And then we want to kind of follow that through a little bit because a lot of nursing schools have already finished finals. And we really want to talk to about what do you do after finals are over when you hit that, like, you know, you sleep for like 18 hours in a row.
Yes.
Or you want to sit in front of Netflix for like 10 days in a row. We want to talk about what should happen or what could happen between semesters to help get you motivated, to get the rest, to get the support that you need to hit that next semester strong. What we have seen happen in the past is students that have been depleted through finals. I'm talking exhausted and tired and have just put it all out on the line for finals, didn't take a break between semesters, and then you start the semester like that. It's been a minute since I've been in nursing school, so don't laugh. So if you just like a minute. So maybe you can talk a little bit about what you felt, kind of what your experience was when you were in nursing school a little less time ago than I was.
Yeah, just a little bit. So I guess I've been out of nursing school for, my God, 2.5 years now, and it's crazy. But definitely whenever you have those breaks, like you finish your finals and you're exhausted, sleep for the 18 hours. Like, it's okay to sleep for 18 hours, but you need to get up and do something. Go see your family, go work out, get back into your habits, and kind of bring your body back to normal, right? So that way you have some kind of reserve for your next semester, because it is brutal, right? We've all been there. Clinicals are horrid. They're 12 hours a day, and you're running around, and you don't really know what's happening, and you're like, okay. And so you really want to bring yourself back to what is normal for you. You want to get back into more healthy eating. You want to work out. You want to reduce your stress in any way you can and relax for those however long you have off. What is it, a week or 2 weeks? It's not even that long.
Because what we see is some students that come in and they'll be like those kind of students that are like, I'm going to use this 2-week break to get ahead for Med Surg 2. No, you're not. Okay, you're going to sit down for a minute. You know, your break times are not really the times for you to be getting ahead or focusing and studying and, I'm going to go and do they do these courses where they shove them into a short period of time.
Like mini courses, like 7-week courses.
Yeah, we don't do those.
No.
So that's what we're going to talk about today. We're going to talk about some of that. So the first thing we're going to do is kind of talk about how to get you through finals, how to get you to do that in a more healthy way. We don't want your liver enzymes skyrocketing. We don't want you self-medicating with ridiculous tons of bourbon or whatever it is that you drink.
Bourbon or Benadryl or NyQuil or whatever.
Yeah, and so we're going to start with some kind of tips and tricks to get you through that, okay? So, finals time. This is what we typically see, and that we are guilty of this too, because honestly, if we turn this camera around right now, we're at the office, we're at our big education center here in League City, Texas. If we turned it around, you would see M&Ms, lots of bowls of chocolate, lots of Kleenex, like a lot of Kleenex, for the boohooing, crying. Yeah. There's some alcohol, not the kind you drink, just regular. I don't know why that's here. It's just here. Some highlighters, but mostly candy.
The essential oils are also going.
They are. So we're kind of guilty of that too, in that we want to self-medicate ourselves with sugar and caffeine and alcohol when we do really bad on an exam. But the problem is that it's really setting yourself up for failure. So one of the big things I want to talk to you guys about before is how to study. Okay, so here I'm going to tell you my tricks, and then Jared can kind of tell you his tricks that he used. So the number one tip and trick I can give you when you're studying, especially for finals, is to study in color. Okay, black and white does very little for us. The only thing that it does something for is like newborn babies, because that's all they can see in black and white, and you's not a newborn, no. So studying in color is super helpful. We have like buckets of coloring stuff all down the table for students to use when they're in session, because your brain will not always remember writing. You've seen so much writing in your whole life, it's kind of like, yeah, I've seen that already, but it will remember colors. So if you can associate a certain drug with a certain color, your body may be able to remember that a whole bunch better. So you'll see when we have tutoring sessions in here, everybody kind of brings their colors and their crayons or whatever it is you want to use, sets them out on the table, and we do everything in color because your body will remember it so much better. The other thing I will tell you is do not highlight things that are important, because if you ever use a textbook, you open up a textbook and a nursing student that highlighted what was important. You know what I'm talking about?
Everything is highlighted.
Everything is highlighted.
I was guilty of that in Patho. Like literally my whole book was highlighted.
And you're like, this is important.
I can't learn anything.
This is not that important.
Yeah.
So write in color, okay? And you can use highlighter to you know, kind of just make some pretty pictures and stuff. But highlighting the important stuff is really going to do you very little to no good whenever you're studying. Third thing, I don't know if this is the third thing, I just made that up. Third thing, my third tip, is to use the book as an adjunct rather than your primary. Use a textbook, okay? So what we see is students that have come in here and been like, I just read all 550 pages of my pediatrics assignment. And I'm like, and how much of that did you retain? Hint, it was like none. So research has shown that we only retain about 10% of what we read. So what were the odds that that person that came in and read 550 pages as their first assignment for pediatrics, right? They're only going to retain about 55 pages of that 550. Look how good I am at math. I did that like that, like just like that. Feel really good about myself right now. Anyway, so they're only going to retain about 55 pages. So what are the odds that those 55 pages of material are going to be exactly what's on the exam? Another fun fact, we know nursing school exams are going to pick out the most random, obscure things you won't remember anyway, okay? So you're really doing yourself a huge disservice by spending days and days and hours reading hundreds and hundreds of pages of a textbook that you're only going to, I'm done. Help me. That you can only retain about 10% of anyway, okay?
Right, and so what really helped me was you have to set yourself up from the beginning. Like the first day, the first test, you have to be ready to go. Like it's a marathon. It's not a sprint, and you can't sprint the last 26 miles of the marathon. Like that's not how nursing school, that's not how testing works. So what worked for me is that on the very first day, right, you kind of go over the syllabus for like the first 20 seconds, and then it's kind of whatever. Yeah, there's no syllabus day in nursing school. It's horrid.
Yeah.
Honestly hated that. Mm-hmm. But what worked for me is take whatever PowerPoint or whatever material they give you and give yourself an outline, right? What did they focus a lot on? What did they touch on for 5 seconds and then move on to something else, right? If they moved on after 5 seconds, it's probably not that important and they probably don't care about it. But if they spent 20 minutes talking about whatever subject or whatever material, then you need to take a second, like, hey, I really need to know this and I need to be able to apply it to the test, right? And so what helped me is I would make these outlines a day or so after class, and so I had time to digest what they said in class, to rewrite it in my own words for an outline, and then every once in a while I would go through the book and say, okay, what is really heavily covered in the book, right? Because we had one professor, God bless her, she would pull those obscure facts from a textbook, right? And those are your worst professors because they didn't talk about it really in class, but...
Or they said, this is not important. And you're like,
Yeah.
cross it off my list.
Right.
Then there's 42 test questions on
Right?
it. Yeah.
And so I remember one time she asked a question and there was a huge debacle in class about it, but it turns out that there was like 6 pages of it in the textbook of this one section, right? And so what I would do from that moment on is I would just go through the textbook and say, okay, is there any big section that I should probably skim over, right? And I don't want to miss a big section. Like 6 pages in a textbook of 20 is kind of a bigger section on that chapter.
Mm-hmm.
And so I would incorporate that information or at least skim it and be somewhat familiar with the material. And then I would have each one of those outlines for whatever subject matter. For critical care, it would be EKGs, hemodynamics, neurological assessments, things like that. And at the end, I would have a stack of outlines that I knew by the back of my hand. And so I could just go through each of them and remind myself of the outlines, because I wrote the outlines with material from class and from the book and from my own kind of, I don't know how to put that because I just lost my train of thought. But
I do that 99% of my day. I just start talking and do you watch The Office? This is totally off subject.
Unpopular opinion, I don't like The Office.
Okay, we have to end this video because that's embarrassing. I'm sorry he said that. I don't know why he said that. He didn't mean it. Anyway, there's one where Michael Scott is talking and he's like, sometimes I just start talking and I don't know where it's going. That's me 99% of life.
Okay, yeah, I can
So yeah,
see
I
that.
totally get that.
Yeah.
But I think what I'm hearing your point is that you should use a textbook more as an adjunct to like, hey, I'm still really not getting this whole calcium thing. I just, she said it in class, I've done practice questions on it and I don't get it. So I'll go to the textbook and just read on calcium or just read on COPD emphysema or just one little spot, because then it feels like I can digest that and I can bite that a little bit better rather than I just read 300 pages on acute respiratory failure and here's what I know.
Which is nothing because acute respiratory
Acute
failure is a
means
lot.
it's
Acute is
happening now.
Right now.
And that's
respiratory failure, you're probably into.
You're not doing well. Okay, so that's kind of how we use textbook. Okay, the other research has shown that writing out notes is way more beneficial than typing on a laptop. So if you're trying to type things, which it is faster, I'll give you that. Okay, it's definitely faster. But research has shown that actually writing out is super helpful. And what we'll do after the session is we'll give you guys our disease templates for free. So you can look and see what they look like. And what we basically do for every single disease process in here is go over, here's the patho, here's the signs and symptoms, how do you diagnose it, how do you treat it with meds, and here's your nursing care. If you can do that for every single disease process, there's really very little that they can test on that's not covered on that. Patho, signs and symptoms, diagnosis, treatment, nursing care. We do that for every disease. And we do them in here as a master together so that way they have every detail of the disease. And then they use them in studying to kind of freehand and to write out like, okay, this is, let's say it's rheumatoid arthritis. And they're writing patho, okay, what happens is it's an autoimmune disorder, there's a genetic factor plus a trigger, and they're writing, and then they get to signs and symptoms and they get stuck. And then they'll know, man, signs and symptoms are not really adding up for me, and it'll kind of help to direct your studying. So be looking for that, or we'll probably just post on the page because I don't want it to get lost in some of the comments. But we'll post those, and they're excellent to utilize for studying. Probably the best that they're used for is endocrine, because they come on a set of 2, so there's like one on this side and one on this side. So you can compare hypothyroidism with hyperthyroidism, hypoparathyroidism with hyperparathyroidism. So you can compare and contrast. It's also good for things like DI versus SIADH. It's good for emphysema versus chronic bronchitis. You can see it all on one page and kind of see what that looks like, okay? So to kind of summarize what we talked about so far, write in color. So anything that you're doing needs to be in color. Don't highlight all the things on the planet, okay? Don't read thousands of pages of a textbook and expect yourself to retain it because your brain does not work that way. Nobody's does, okay? What else did we say? Was that good? No, we missed it?
Yeah, I think so.
Disease templates.
Yeah.
Disease
templates,
templates.
and only use the textbook as an adjunct. Like, don't...
Yep.
It's good information to have, and pretty much anything that you would ever want to know is in the textbook, but no one has time in a couple weeks to physically memorize everything in a 50-page chapter of a textbook.
And memorizing will do you a huge disservice. So that was my other point that I never made. It was in my head, though. I just
Oh, yeah?
I thought of it, but like it hasn't...
Is that like an A for effort, but F for failure?
Ah! Okay, so what was it I was going to say? I lost it already.
What is happening with
I
you?
don't know.
Do
I'm
you
so
need some
tired
coffee or
today.
something?
No, I have not slept. My children don't sleep because they
Memorizing
just
is
want to
bad.
hang out with me all the time.
Well, yeah.
I know. I'm very cold.
Memorizing is bad.
Memorizing's bad. Okay, so not bad. I don't want to say it that way. Memorizing is bad. There are some things you have to memorize. Like you
Yeah.
have to memorize potassium levels. levels. Like those are just things
pretty
you're
much
gonna have
all
to...
of your lab values and all of
Yeah.
your results. Like you
I mean,
have to be
there
able to know
are
what those
mnemonics
are.
and ways we can help you remember, which we have a full decoding lab value series if you're struggling with labs. We have one that's like cardiac labs, kidney labs, decoding the CBC. So like those are super helpful, okay? But some things, I mean, little things like that you're gonna have to memorize. But this is my number one thing I will tell you for all of nursing school, is to focus on the patho. And I don't care what class you're in. If it's Med-Surg 2 and you're learning COPD and emphysema and RA and lupus, if you don't understand the patho, you will not get through the rest of the disease process. That's why on our disease templates, we start out with patho, okay? Because patho makes sense when you look at the signs and symptoms. So we match up everything. We start with patho, then you can get your signs and symptoms just from the patho, right? And then your diagnosis, treatment, nursing care, right? When students get stuck on nursing care, like, I don't know what to do for this disease, I say all you have to do is go back to the signs and symptoms and you treat them, okay? Let's do one for example. Like, let's say we're studying COPD, all right? Patho of COPD, people smoke and they smoke and they smoke, and there's this huge inflammatory response after inflammatory response after inflammatory response, and then we smoke a little bit more, and then our lungs are like, stop it, I don't like it.
And
so
then they keep smoking.
Exactly, and so there's this huge inflammatory response which brings out tons of fluid, right?
Excuse
and
me.
also... Do you have COPD?
I swear to God,
When he gets this weird cough, we call him COPD Carol. Bless him.
I feel it's this weird flu kind of thing. I don't know what it is. It's not contagious. I'm not.
How do you know?
I'm not sure.
See, you don't know. And that's why I'm sitting
pretty
a
sure I got
little
it from
farther back
somebody.
than him. I'm letting him have the spotlight.
Yeah, thank you. That's
also
why.
because the viral particles are going to go that way. Anyhow, so with COPD, right, so we've got this inflammatory response. All this fluid is coming out, right? And their lungs are like, please don't smoke anymore because I don't like this noxious smoke. So they're going to bronchoconstrict. Yes. They're going to be producing a ton of mucus because their airways are super pissed, irritated. They're irritated.
Pissed.
They're mad. They're mad. And so they're producing lots of mucus to protect themselves, okay? So you've got mucus production, we've got bronchoconstriction, and then because you've ticked it off so many times by smoking 400 cigarettes a day, then you also have airway inflammation. So those are the three things I always tell students with COPD. Airway inflammation, bronchoconstriction, okay? And the third one, which is mucus production. Now we get to signs and symptoms, are like, they can kind of figure out the signs and symptoms. Obviously they're going to be coughing, yada, yada. Okay, I'm holding up 3 for a reason. I'm not just standing here like a weirdo. But Emmy did learn how to do 3 with her fingers
she?
this week because she's 3. My daughter, she's so cute. But it looks sort of like this, but she tried really hard. Anyway, she'll show you in a little bit. All right, anyhow, so those are the 3. So when students get stuck on what's the treatment, then I say just go back to your signs and symptoms or go back to your patho. Bronchoconstriction, how do we fix it? Give them a bronchodilator, okay? Mucus production, how do we fix it?
Chest physiotherapy.
Chest physiotherapy, we can give them a anticholinergic to dry up that crap, that stuff, those bad things.
Get
Okay.
them moving. You got to get them
Airway
walking.
inflammation. How do we fix that? We give
Steroid.
them a corticosteroid. Exactly. So it all matches up. So that's why we love the disease process template so much, because you can just match up all of your signs and symptoms with your nursing care, and it makes it so much easier. If you try to memorize 428 disease processes,
You're going to be here
you're
for a
gonna
long
be
time.
you're gonna be here for a minute. You're gonna be lost, okay? So we don't memorize here, okay? Even when you're in pharmacology, that's the number one thing I can tell students is to start with the patho of the disease, because if you can understand the patho of the disease process, then you can understand how the drug treats it, okay?
Yeah.
So we'll do one for a quick example so you can see what I'm talking about.
Like hypertension, right?
Okay?
So there's different kinds of hypertension. Sorry, that made no sense at all. Hypertension is treated with different kinds of drugs, right?
Yep.
Some drugs relax heart contractility. Other drugs vasodilate the patient, right? And so you have to know what class of drug you're talking about, like your beta blockers. Beta blockers are handy because they do a ton of different things, right? So some beta blockers will work directly on the heart to relax it, and they, like metoprolol, for example, they reduce your heart rhythms. They will vasodilate your patient. They will reduce your cardiac contractility, and that's just one class. And how many do we have? There's beta blockers, there's ACE inhibitors, there's ARBs, there's calcium channel blockers, right? And so you really have to know what you're trying to treat, right? I hope that makes sense.
Yeah, that's what and so what we do, like, let's say you're doing beta blockers, right? So we start out with, where are beta cells, right? They're in the heart and they're in the lungs. And so we kind of start out with the patho, and it makes more sense as far as the adverse effects if you just know what the disease process is. Like probably the easiest one is like anxiety and benzos. All right. So what is anxiety? You guys would know because you're probably experiencing it acutely during finals, right? So your brain is rapidly firing, right? So we're going to give a benzo, which is going to calm all that down. So all of your adverse effects will be CNS depression. Okay, so it's super easy. When you think beta blockers, you said what do? They decrease heart rate, they decrease blood pressure, and they decrease the electrical crazy activity. So what are my biggest adverse effects? Bradycardia, hypotension. Okay, and then we calm down the heart so much where it may be like, I don't really want to do anything today. Okay,
Right.
so that would be decreased cardiac output, right? So it's easy when you start with pathos. So that's one of the biggest things I can tell you as far as study tips. Now, when you are studying, there are some things you can do to increase your memory, increase your learning. And I like to use essential oils. And I know he thinks I'm a weirdo hippie. I'm not.
Okay. Essential oils are great in their spot, right? And I have an example of this, as I saw on Facebook the other day.
Okay, go ahead.
Of somebody asking, it was a comment, it was some kind of meme, and it was turned into, and it said, the original poster was like, hey, nurses out there, do y'all know any oils that would help with AFib? And so some wise, cracking little nurse, probably some cousin of mine, commented on there and said, yeah, coumadin oil, cardiovert oil, and amiodarone oil.
Now let's back up for 1 second. I hear you. Now I'm not saying heal my, COPD, Carol. Okay, with essential oils, that probably won't work. But research, science, and medicine has proven, don't listen to him right now, okay? Listen to me, the hippie essential oil person, okay? Research and science has proven that there are some essential oils that can help to augment your learning. Now, if you sniff peppermint oil, are you going to be brilliant and remember every drug in pharmacology? Yeah. No, just kidding. No, you won't. Okay. But it will help to increase your memory and learning. So I want to go over a couple of my favorites with you so that way you're able to shut up.
I'm sorry.
Leave me alone. He doesn't know.
Hey, if it works for you, great.
See?
Use it.
Mm-hmm. Have you used them before?
Nope.
We're infusing peppermint right now and you're already smarter. So
That was hard. I was already so smart before.
Yeah, but now it's better.
Oh, okay.
So anyhow, while you're studying, you can get a diffuser. They're on Amazon, super cheap, no big deal. Peppermint is what is going to increase your learning and memory the most. It's science.
I have heard that before. That if you
from a doctor, because it's true.
No, I'm a nurse and I have my own science.
Yeah.
That was good.
Burns.
That was good.
I need some essential oils for this burn. Yeah.
I have heard though that if you chew on peppermints while you're studying and then you chew a peppermint while you're taking the test, you remember it better.
If they let you chew peppermints while taking the test.
Well, yeah, nursing school's a little crazy.
Isn't it weird? Because I've noticed that some of the students have come in and they're like, we can't chew gum while taking our test. Because apparently you can write.
Can you write on the gum?
On the gum and then you like pull it out while you're taking the test and you're like, oh, AFib is treated with amiodarone.
That's not how anything works in the world.
Yeah, but anyway, yes, you're right. So peppermint, you can either take it in internally, or you can diffuse it while you're studying. We have a lot of students who have test anxiety very, very severely, and so we will have students that borrow our lavender essential oil and will be outside their testing center just like dousing themselves with it. Maybe chill for a minute and always test it on yourself before you go into an exam so you don't go into like, I don't know, anaphylactic shock in the middle of pharmacology 101 test.
From lavender.
Yeah, but lavender is known for its calming effects, and so I usually use it at nighttime as like a calmer downer to help me sleep better. Obviously, it's working really well. Calmer downer. It's a medical term you don't even know. Okay. So we use it. I use it at nighttime, but you can also use it right before an exam if you're feeling really nervous and anxious. Put a little bit on your wrist here and just like smell it, not in a weird way. Don't be like outside the testing center, like, and then everybody
that's
thinks.
Gonna look like you're doing drugs.
Yeah, so don't do that. But other than that, it's really, really helpful. And so, there's lots of people commenting that I've missed.
I know.
My bad.
I keep seeing
I'm gonna come back and talk to all of you. I swear. Okay, Marissa says we can't wear a watch. Explain that one. Well,
Marissa, the world is messed up.
Yeah, I know. I don't know. I guess you have all the answers. Maybe there's like an Inspector Gadget.
Yeah, maybe I will like talk to you. I mean, I can see like a smartwatch or something, but
yeah, smartwatch I can see no.
Yeah.
But what do you got on?
I have a Beluva watch.
Oh, it's so fancy, so fancy. You must get paid very well wherever you're at.
I mean, I work.
But yeah, I don't know. It's weird. I don't get it.
I think I've actually when I was in nursing school, they wouldn't let you wear any kind of rings. Like women had to take off their wedding rings. Mm-hmm.
What about the men?
Well,
equality, equal rights.
I mean,
Feminism.
power to you, but men don't usually wear their wedding ring as much as women.
What kind of men do you know?
My dad didn't wear a wedding ring.
This is going downhill. I can feel it. It's going downhill.
My dad didn't wear one for like the first 30 years of their marriage until because he can't with work.
Okay, now I understand.
He works in like a plant, and so there's risk that it could melt and like burn his finger off. That was the reason he didn't wear it.
If I was his wife, though, I'd still be like, yeah, risk the finger burn off. You wearing the ring today.
She got him some little silicone rings.
Oh, see, that's cool.
It's a little black one that he wears. It's really weird to see him after.
But I don't know what the deal is with nursing school tests. I guess everybody's cheating. And that by the way, is super heinous if you are cheating in some kind of way. I don't care how you do it, but it's just ridiculously heinous. Don't do that. You are trying to save someone's life, and make sure you don't murder them. And so really important that you actually know your stuff. Okay? Yeah. So peppermint helps with learning and memory. Lavender will help if you have test anxiety. If you have ADHD and you are in nursing school, that is a feat in and of itself. It is more difficult. It's harder for you to retain information. We know how that feels. And so it can be an extra challenge for you. Do y'all have any tips for self? Oh, okay, Ashley, I'm coming back to that one. Give me just a second. It's more difficult, and we understand that. So students that have ADHD do have some extra challenges. One, I will recommend to make sure that you get your testing accommodations. That will be really helpful. But there are a couple of essential oils that can help you as far as the ADHD portion. Leave me alone. This is very important.
Stop licking my face, okay?
Vetiver is one of them, and cedarwood is the other one. And those you don't diffuse. You put them on the bottom of your feet at nighttime, and they can kind of help you to be able to focus whenever you wake up the next morning. And it has very much a calming effect, so that way you can get a good night's sleep. Okay? Oh, Kelly said they can't wear sweaters.
What?
What if it's cold in there?
What kind of Nazis are running these nursing programs?
And it says the beeping on digital watches, like the alarms, are considered a distraction. That's what Lindsay said. Okay, I can kind of see if it's beeping, but just like a regular old school watch, like why can I not know what time it is? I don't know.
Ours were
it's gotten a little
so
kind of
see what time
crazy.
It is, but...
Well, I was in nursing school when we were doing like Braille and writing on hieroglyphics and stuff, so we didn't have things like that.
I thought you said it wasn't that long ago.
We were doing this new retro thing. Anyway, so yeah, we know that testing can be a challenge. But however, the essential oils, if they work for you, great. Give them a try. If they don't, that's fine if you're not a believer.
I'm a believer in the power of the mind.
There is a lot of research out there that shows that it is really effective. So those are things that definitely can help you. Mm-hmm. Okay, so that's essential oils. That's kind of study tips. We're kind of figuring this out. We want to quickly talk to you about not ruining your body in nursing school.
Oh, no.
Go ahead.
Did you ruin your body in nursing school? I did ruin my body. Mm-hmm. Horribly. Okay, so my problem was, I know some of y'all aren't from Texas, but in Texas we have this place called Whataburger, and it is probably the best food God gifted mankind with. And it's fast food joint, and it was right around the corner from my apartment. So anytime at all that I felt stressed or that I was moderately hungry in any capacity, I went to Whataburger. Or just bored. Like, I don't really want to study this right now. I'm going to go to Whataburger and get some food, right? And so I ate fast food all the time, and I felt horrible all the time. And it wasn't really until I got out of nursing school and I had like a month or so off that I could like bring myself back to my normal, right? And even then it still took some time for me to like lose all that nursing school weight, and it was not fun. So please avoid that pain. If you can. Now, I tell students, you're gonna gain weight in nursing school. It's stressful. We know that your adrenals are like running crazy and you're in a chronic stress response. So from a medical perspective or nursing perspective, we know that you're releasing a ton of cortisol, which increases your blood sugar. It increases your blood pressure, right? And did you know too that cortisol decreases your serotonin? So when your body is in this stress response, it's decreasing your serotonin, which gives you what I call like the nursing school blues, where you just constantly feel like... Yeah, that's why we have Kleenex all down the table. I mean, there's Kleenex literally all over our center just because... There's like 4 on this table alone. I know. Are we really that bad? It's finals time, so we bumped up the Kleenex, bumped up the tissue. We did. We buy them bulk now. But I tell students too, it's important to release that. This is a safe place for you to do that, to come in and be like, man, this sucks, because it sucks. Whether you're in a regular program or you're in an accelerated program or whatever it is that you're in, nursing school is hard. And that stress response, if you don't give it a break, then you're going to be in a chronic stress response. And if you've studied Cushing's, you will know you can get Cushing-like syndrome. You've been through nursing school. Anybody feel this on a personal level? Like their face gets kind of a little chunky. They get a little extra fat around the abdomen. Your blood sugar is going kind of crazy and you're wanting to eat kind of all the things. And are you talking about me?
Right now, today. No. So we want to talk to you about healthy eating during finals, but I also want to make sure that you're giving yourself a break between semesters to let your adrenals settle down for a minute, let your body settle down for a minute, and get back healthy before you get back into the next semester and that stress response gets initiated again.
And guys, you don't really have to like go work out for 7 hours at the gym the day after finals.
Right?
You can, absolutely, if that's what does it for you.
But you can't.
Go.
So
you don't have to, right? Even if it's like walking around the block a couple times, just get your body moving and de-stress. And that's what I used to do actually after I took a final and I knew I had one the next day. I would like de-stress for about like an hour or so. Like just walk around my apartment or walk around the track, like just for 20-30 minutes, just kind of move. That's what helped me, honestly.
Yeah, I think moving around really helps. And that still helps me. I'm not in a total complete stress response 100% of the day, only like 98. But I hate that feeling of, oh my God, I have to go work out. I don't want to do it. I literally am fighting with myself. There's like an angel over here and like a devil over here. And it's like, you need to do this for yourself. And then the devil's like, eat more chocolate. So it's like, there's going to be an internal struggle, but everybody knows once you get out there, how much better you feel. So I'm telling you, getting moving is one of the best ways to de-stress. It's going to increase all of your good feelings that your cortisol has wiped out when it decreased all your serotonin. So it will help. Now we're about to give y'all some advice for today. I will be the first one to tell you I didn't follow all this advice in nursing school, and I was a miserable mess.
I wish I'd followed this stuff.
Take it with a grain of salt. Take what works for you. Take what doesn't. I'm going to tell you to eat kale. He's going to laugh at me, okay?
I mean,
but I'm just
kale has its place in a salad, heavily coated with dressing.
Okay, and that's fine if you have to do that. But here's the thing when you're eating, especially for finals. The easiest things for us to reach for, sugar and caffeine. We know from a medical perspective that those are going to shoot us up and we're going to feel good for about 15, 20, sometimes 30 minutes, and then our blood sugar is going to drop and you're going to feel like garbage. So if you're going for a final, especially first thing in the morning, do not reach for the Pop-Tarts, okay? Do not reach for a bag of Skittles, okay? You're going to crash right in the middle of your exam and your brain is going to starve and you're not going to remember the things that you would have remembered before. So best thing to do, think about your diabetic patients. What do we tell them to eat? More protein, right? So you're going to eat something that's going to help you survive over time. Do not skip breakfast. Do you hear me? That is one of the biggest mistakes, I'm about to tell you the other one, that you can make whenever you are taking finals is skipping a meal. Your body is going into starvation mode. Your liver is rapidly trying to give you some sugar. Nothing is going to work correctly, so you have to eat. Do you hear me? Eat something that is heavy in protein, like eggs or bacon or sausage. I'm so hungry right now. When I'm talking, I don't know. I have like an inner factor that I just gotta feed.
I would always wake up like early. Every once in a while, I would wake up like super early, and if I felt the need to review something, I would. I don't recommend that.
Nope.
No, please don't.
Do not review the morning up. It will just panic you because you'll start looking through things and be like,
oh, I don't remember that fact. Yeah, and I'll be like staring at my notes like on my way, like about to get hit by a car or something. But make an omelet. Like just crack some eggs, scramble them, throw in some veggies.
That will help you. Yes, exactly. Way better than, and that will help you to survive throughout the exam. That my other thing I cannot stress to you enough is to sleep. These all-nighters are bullshit, to be quite honest with you. They're ridiculous. Yeah. I think that as a culture, we've come to appreciate for some reason this never-ending work ethic, and I'm busting my ass all the time, and that is stupid. It's actually really stupid. Pulling an all-nighter does you the most disservice because your body is tired, your brain is tired, you haven't slept. So anything that you have managed to like shove into your brain will come right back out because you sleepy. Okay? So I always set a time to finish. Like if I have an exam at 9 a.m. the next morning, then I'll say, okay, at whatever time I need enough time, 10:30 tonight, I'm done and I'm putting it away and that's it. Okay? And then you set that time so that you can get some sleep, wake up, eat breakfast, sit around in your robe, watch a little bit of a TV show.
Were you watching me in nursing school?
Yeah. That got weird really quick, but yeah.
No, I mean, that's honestly, like, I would. I still do this even now before work, just to like kind of bring myself down and like get myself in the mode. Is I'll wake up and I make some toast and peanut butter because that's my everyday go-to meal for breakfast. And I'll sit there with my coffee and I'll literally watch an episode of Netflix before I go to work. I don't care if it's 5 a.m. I'm watching an episode of Netflix. Like what are y'all on? I'm Game of Thrones in right now. So hard.
I've never seen it. I feel like we have opposite TV tastes, and it's going to start to get awkward.
How do you not like
the
Game of
camera.
Thrones?
How do you not like The Office, Psycho?
I just don't like that kind of humor. Like, it just doesn't apply to me. I don't know.
How does it not apply?
Maybe I'm
it's
just
the most
above it.
funniest.
I don't know.
Oh! That one was hard to swallow, and it was stupid.
No. Game of Thrones is just kind of my jam, and so I've been watching it like a crazy person, ready for the last couple episodes. But back to the point at hand. Do whatever you need to de-stress. Drink your coffee if you need to. Don't
overdo the coffee or the
don't
sugar.
take the creamer
or
and
the
just
creamer.
dump it in there, okay? That's not healthy. Okay, it's gonna do no good.
You will drop. You'll just drop in your sugar, and it will just make you.
You might
feel
as well
like...
have eaten the Pop-Tarts.
Yeah.
Yeah.
Which are so tasty, by the way. We're not saying they're not tasty. They so are. But in order to give yourself the best chance of success, you get a good night's rest the night before, set a time where you stop studying, and then get a very, very good breakfast, eat, do your thing. Oh, let me tell you, I want you to say some stories, because I'm sure that you remember this more than I do, okay? But do not sit outside your testing center or your whatever, your room that you're sitting in, and listen to the chatter of the other people talking. Because inevitably, you're going to have a couple of different students. You've got the know-it-all student who's like, did you read page 47? And the notes it says that.
But so-and-so said it's something different in class.
Yeah, so
and
which one do you think it is? Did you study that page? And you're like, I didn't even open the book.
I didn't even buy the book.
I've been there before. I'm like, whoops.
I stopped buying the books about halfway
That didn't happen.
through, yeah.
So you got the know-it-all, right? And then you've got the slacker that just kind of walks in and looks like they rolled out of bed, but they always make A's
or they're
somehow.
always late to class.
Yeah, but
or
they just
to the
roll in
test.
and they're like, I didn't even study, but like I made like a 97 on the last
ruins the curve for
exam.
everybody. Thank you.
So I'm like, okay, there's that guy or girl, whatever, sitting there. Then there's a know-it-all in my head, like, oh my God, she knows all these things that I don't know, and I'm like kind of panicking. What are some other types that you usually see?
So we had groups that would sit together and like quiz each other, and it was the most annoying thing is because it was a small room and like you couldn't really get out of it because the testing sites were on either side, and so you'd be in this enclosed area and people would start quizzing each other, and you're like, well, I don't know the answer to that. Shit, I don't know the answer to that. Right? And so you start building up your own anxiety about things that you don't know. And you probably already know enough to make a decent grade on the test. Right? And so you really have to bring yourself and just zen out, right? Just take yourself away from that negativity. And it's not negativity because they're just trying to get a better grade, but it's negative towards you. So pop in your headphones, listen to Adele, listen to whoever you need to, right? And just zen out for the moment, right? And that's what you got to do before the test. Get yourself in the mode and get yourself ready.
And do not listen to any of those other people. It's ludicrous. It used to annoy the ever-living bejesus out of me because I felt like half the time they were talking, they were really just trying to like impress other people or trying to like make other people anxious.
You know who I'm thinking of.
I
in my
know.
class.
I know.
Yeah.
And that's mean. And I'm going to stop from this is not even on my itinerary. I didn't even write this down today. But I'm going to say there is a special place in hell for people that do not help other people in their cohort. Okay? This is not a competition to see who's going to be the best nurse or to make the best grades or to get the best job. You're all working together to learn how to save patients' lives.
Guys, here's a secret about nursing in general. Nobody cares about your grades, right? Not a single person, no patient, no doctor, not a manager, director,
Do you
or
mean
whoever.
it's not written on your diploma?
It's not.
It's not written on your
my
license?
Nope. It's not written on anything. I have a degree and I have a license. That's all they need to know, right? And honestly, if you think that you are smart enough to code somebody by yourself, you're dead wrong.
Yeah.
Dead wrong. Like, it takes a frickin' village of like 30 nurses, and hopefully there's a doctor there. Fingers crossed, because sometimes at night it's a little sketchy.
You could run a code by yourself.
Well, probably, but I don't want to.
No, nobody wants to, but you could.
You know, ACLS actually doesn't cover you to run the code by yourself.
Well, hell spells.
Right? That's what I.
But
that's
you
what
got to do
everybody-
it, otherwise it's patient abandonment.
So-
They're like, here, let me give you an algorithm,
no.
but if you use it, you're screwed.
No,
What?
you literally have to bag the patient and do compressions,
And
like
just
30
sit there?
and 2, like BLS, until a provider's there, you get one on the phone. We had this whole problem at our hospital because we all had ACLS gave us, right, okay, here's epi, like push epi, and the doctor's like running down the hallway, right? No. You have to have a provider say, push epi now. ACLS is there to give you the guidelines and the knowledge to know what is expected of you in the code, right?
That stinks. Meanwhile, they are legislating right now to let nurse practitioners practice autonomously.
Hallelujah. Maybe I'll actually go back to be a nurse
I'll-
practice.
Yeah, do. We can run our own clinic. It'd be amazing. Anyway,
I would not.
I'll
work
do the
outpatient.
pediatrics. Don't worry. Okay.
I have acute care. You know that.
I know. All right. Anyhow, what were we talking about? I lost it.
We totally like went off on like.
I know.
7
We went off on a
tangents.
tangent and I lost it. Oh, there's a special place in hell for people that don't help other people in their cohort. Okay. Your job is not to make other people feel like crap or for you to say, I can memorize like everything I've ever read. Nobody cares, Karen. Okay? So
It's always
that's
a Karen.
rude. It's rude. the best groups are the groups that help each other, because you will do yourself a huge disservice if you already set it up in your cohort or in your class in nursing school that you do not work well with others, that you have to be superior, that you have to be better, and you have to make the best grades. Here's a fun fact, Allison, or whatever your name is, okay? The thing is, you will be unlikable. Yeah, it's Allison sounded like kind of a name at the time. I don't know, I just made that up. Anyway, you will do yourself a huge disservice. People will not like you on your unit. You are known not as a team player. So now in nursing school is the time for you to learn how to work well with others. Angie, okay?
You are just
I don't
naming
know.
people
I know they
random.
all start with an A.
Are these people all watching?
No, they're not even on here.
Are
I'm
you
just
sure?
saying. No, it just sounds
Damn,
like
you're
those are
calling
names
people
of people.
out.
I know. Okay.
Savage I'm sitting next
So
to.
you have got to help each other. That's what you're here for, because when you get on a unit, you're going to want every person at your disposal helping you. Being a nurse in the first year was one of the most vulnerable times of my life. I literally would cry on the way to the hospital and think, I do not want to kill a kid today. I do not want to kill a kid today. You're going to need help. So if you're setting yourself up as I'm not a team player and I have to be the best, and oh, you didn't read page 98? Well, if you had read the recent research, I don't care, okay? Yeah. The purpose of us is to learn enough so that we can pass nursing school, we can get out there and be the nurses that we were meant to be, and help the other people in our unit to have better patient outcomes. So don't be the jerk who always makes other people feel insecure about themselves or how much they studied, or say, oh my God, I stayed up all night studying and I feel like I've memorized every part of Mosby's.
It's one, okay, so
dare
here's
you.
a side note to all this.
Okay.
It's one thing if you can memorize all this and you have, what is it, photogenic memory, where you can look at a page and know everything on it. That's great. You're a wonderful person. You're really smart. But in a situation in the hospital, I could give you 100 ways to do one thing in the hospital, right? But if you can't stop in the middle of an emergency situation and know why you're doing something or what the outcomes of every action that you have are, it's useless information, right? So that's why we say don't memorize things and don't be that know-it-all, or don't make your other people feel that way, because you need to be able to apply every ounce of knowledge you have to save your patient or save somebody else's patient, right? Because it's not one of those where if the primary nurse doesn't know it and I know it and I'm just happen to be another nurse on the unit, I'm going to let her drown, let her patient die because she didn't know it, because she was a bad nursing student. She didn't read page 47 in the book,
It doesn't
right?
work
That's not how
way.
that works.
Yeah. And it's dangerous. I feel like the nurses who have that mentality, or the nursing students, maybe I should say, who have the mentality of, oh, you don't know this, or I know this, those are the most dangerous nurses, because they're afraid to be vulnerable, and they're afraid to say, I don't know this, or I don't understand why we're doing this, and you'll hurt somebody. So it is very important for you to be vulnerable, to say, I don't know what you're talking about, or I made a mistake. That's the other big thing, is sometimes we'll see these people who have to be perfect and have to be the best in nursing school. They'll make a mistake, and because they have that veil of protection, they're very afraid to admit they made a mistake. Okay?
And that's one thing that you cannot do in the hospital. You cannot refuse to admit that you made a mistake.
You'll kill
someone.
someone.
It's your mistake, you have to admit it. You have to call the providers. You have to say, hey, I fucked up. Oh God, we're not supposed to
my
cuss.
God, don't say that.
I'm sorry.
We'll bleep it out.
Horrible potty mouth.
Yeah, that's true. I'll brush his teeth.
But you have to step up and say, hey, I accidentally gave too much insulin, or I accidentally hung potassium when I wasn't supposed to. Like, you have to step up and say that, right? You have to let somebody know. Otherwise, it's your butt on the line. See, I caught myself. I didn't say.
Very good.
Thank you.
Your bottom is on the line.
Your bottom and your license.
And the patient will probably die. So, all that to say, be kind to each other, help each other, form study groups, help people that are struggling. If you see someone struggling, some people's first inclination is to step on them to make themselves feel better. But those are the students you want to bring up, because I have seen time and time again students who struggle academically, and they will think inside, like, nursing is not for me. I can barely make C's. I'm barely passing these classes. I will ask them one question, and I have never had somebody not answer it in the same way. When they come in and they're feeling broken and they're like, I am barely passing, I suck at this, I'm never going to be a good nurse, or I'm never going to be a nurse, the one question I ask them is, how are you in clinical? And 99.9% of the time, actually it's 100, I just didn't want to be that person that said 100.
The person that we're talking about?
The person I was just talking about. So 99.9% of the time, they will say, I excel in clinical, I love my patients, and I always get very good reviews from nurses. So how you perform on an exam is no indication of the type of nurse you will be, because there are no test questions that teach you how to hold a patient's hand whenever they're dying, or how to tell a mom that her son, despite your best efforts, has passed away. You worked on him and worked on him. There's no test for that. That's a skill that, and it's not just even innate. I feel like it's something you can learn, even though I feel like you can't really learn empathy. You can learn how to be kinder to others and how to deliver the news. So I don't want you to think that just because you don't make 100 on exams, or you're barely even skimming by and passing, that this is not for you. This is for you. You were going to say something?
No, you continue.
Oh, but I was preaching?
You were.
I know, I was
like,
preaching, and I was feeling that nursing sermon. So I want to stop for just.
Is that what we're calling it?
I guess so, man. I just really went for it there. I want to answer just a couple of questions while we're.
There's a lot on there.
There's a lot on here.
We addressed.
I
think we talked to Steven, and that was it.
I know. We will address all the questions at the end, but I just want to see if there's any like. Anna Marie says, I literally hide before exams. Girl, you and me both. I would go and find a recliner and then just curl up in the fetal position behind there until they opened the doors and said, like, everybody can come in, because I don't need to hear the chatter. I had to learn how to block out the chatter because it just gave me anxiety. Kelly, I'm going to come back to your question in a little bit. Teamwork makes the dream work, Jennifer said. Why do old nurses eat their young? Oh, girl, Marissa said that. That is a huge pet peeve of mine, and we're going to cover that in a future video. Jared and I are going to come back on and do one about that, and kind of how you guys can help to bridge the gap, too, between new nursing students and the older nurses, or I shouldn't say older, even just more experienced, and where that disconnect is coming from. So we are going to have a full video on that and what you guys can do, because I know I had a couple of clinicals in nursing school back in the Prairie days. Whenever I would go in and then
changing like hieroglyphs to the Prairie days to
it was a little bit ago.
Year.
Okay. Anyhow, about how the nurses really didn't want me there. They didn't want a student, and they were like, this is just, they didn't want me there. So there are some ways that you can help to bridge that gap, and we'll give you some tips and tricks on how to really survive and thrive in clinical. Things that nurses love that you do and things that they hate that you do, so you can help to make your clinical experience be the best. So we're going to come back and do that. And if you guys have any other big nursing topics or nursing school topics, please feel free to put them in the comments, because Jared and I are going to be going live like every couple of weeks or so. He'll go live one time by himself. That's going to be a disaster.
Well,
you're going to say nothing but curse words, and I'm going to have to bleep out the whole thing.
Yeah, it's going to be a lot of... Yeah.
Don't watch his live videos
like the
unless you have a very
that just dings. That's gonna be sort of like.
Or I'll just hook you up to some like electrodes, and every time you say a curse word, I'll shock you. What? It's scientific and it's research. Anyway, he'll be doing some of those big nursing topic kind of things. So if there's anything you guys want us to talk about, or we can give you some insight on, we're gonna start going live every week. Either Jared or me or Julie is another tutor of ours, and then all three of us will come together in the triple threat at the end of the month, and we'll do one big giant nursing forum. So definitely, shout out to us and let us know if there's anything else we can answer for you. Stacy said, that's awesome. Thanks for lifting us up, and they needed that today. Yeah, that's one thing we wanted to do, is just to encourage you to say, to see that there is an end in mind, that you have to be able to understand your why. If you haven't taken time to sit down and journal about this is why I'm doing this, you will crash and fail, because there were times in nursing school where I felt like an absolute idiot, where I would fail an exam, or I would have a bad clinical day, or I messed up an IV, and I had to go back to my why every single time to say, why am I doing this, and why am I putting myself through this torture? Because why would anybody put themselves through torture if they didn't have a very specific why? Like, I even do this with working out when I'm like doing burpees or something, and I'm like, it's swimsuit season, or something. Like, whatever your why is, I don't know. Whatever your why is what's going to make it worth your time. So I always encourage students to sit down and really think about, why did I start nursing school in the first place? What's my end result? And for some students, they may say, I want my kids to be proud of me, or I want to finish something that I started. I've never finished anything that I started, or I saw, my grandma or my mom or my sister be treated by an amazing nurse, and I want to be that kind of person for someone. So going back to your why every time will help you to get through those tough clinical days, or the days you fail an exam. And surprise, everybody fails an exam in nursing school. It just happens sometimes. You lose energy, or you lose whatever was in your brain, or you have a bad day, or what have you. It happens to everyone. And if they say it didn't, they are lying to you, okay? That's, Karen in your class who always has to make an A, and they'll lie about their grades. You worry about nobody other than you, because after you graduate, it literally does not matter. Half these people you'll never see again.
And guys, I will say something as a newer nurse. the moment you, because I didn't start out in the ICU, and the moment you actually catch something and you actually save somebody's life and know that you had everybody there at the right moment, ready to intervene whenever things did go south, and you caught it the moment it happened, it makes every ounce of stress, of weight gain, every ounce of anxiety and anger and tears and heartache, makes it all worth it. I promise you that. It is the most, I can't even describe that
awful,
feeling.
beautiful, rewarding, terrible, wonderful
it's the best
career
feeling in the world. And I hate to say that because it's somebody's worst moment, but as somebody who's a newer nurse, it's your best moment, and it is something you never forget.
Even if the outcome isn't great, because then you learn the humanity of nursing, because, and especially you do ICU nursing, so it's a lot of skills, and it's a lot of, like, I mean, he will text me and tell me these stories or like these amazing things that he's doing. Hey, I have, you know, whatever these amazing conditions are that I'm like, oh my gosh, I don't even know how to do that, you know? And so I'm really interested in what he does, but a lot of those things are skills, and hey, they're moving and they're pushing this and they're doing all these things, right? The humanity side is what also makes it so beautiful, is figuring out how to talk to the family members and interacting with them, and treating a patient that's intubated and in a coma as a human being, and addressing them and not wiping their bottom without saying, hey, Mr. Jones, you know, we're going to clean you up here. It's the humanity of nursing that I find the most beautiful, but it's also incredibly challenging to do those kind of skill things where you're like, man, I just did that. And I'm like a total badass. There have been days where I know you walk out where you're like, I did that thing. You know, like whatever the thing was, and it just feels so great. Whether you're L&D nurse and you've delivered a baby and it was beautiful and mom got to do like a VBAC and she really wanted to do that, or, you know, an ICU where you have done something cool, like
everything that I ever do, like, I mean, even just as like a new like ICU nurse, like the first time you cardiovert someone from VTAC, right? You cardiovert them into sinus rhythm, you're like, damn, I just saved their life.
I fixed it.
There was 17 doctors in here, but I'm the one who did it. Yeah, so
okay, Jennifer has a quick question, and this one actually probably needs a full video, but I want to touch on it quickly. Jennifer wants to know about, why do some teachers make nursing school harder than most? Nursing school is hard enough without mean teachers that the questions on the test aren't gone over. Basically, I'm talking about teachers that don't want to teach, just expect you to know everything and hates you asking questions. This is not an uncommon concern that we hear from nursing students. I want to be really careful what I say, because we don't ever want to discount faculty or professors, or, I mean, they went into their field for a reason, because they love what they do, or they love teaching, or what have you. But what we have noticed, because we have nursing students all over the country from hundreds of nursing schools, so we've seen kind of the same theme come up over and over again, that students don't really feel supported in nursing school, especially if they are either atypical learners, meaning they don't learn by sitting and hearing a PowerPoint read to them for 4 hours at a time. So I want to be cautious how I approach it, because I think we all are grateful for the education, and we have to get that education in nursing school. But I can understand how some students may feel like they're not getting the education that they need or deserve, or maybe they're not getting it presented to them in a way that makes sense, or maybe they don't feel supported in general. And I don't think it's just nursing school either, because we just were addressing the question about nurses eating their young. So I think this comes from more of a global thing of showing kindness to other people just in general. Maybe sometimes professors, because I've been one before and I know what it felt like, but I wasn't really out of nursing school that terribly long when I was teaching in academia. So I feel like I could still kind of relate to students, but it may be that sometimes when teachers teach for a long period of time, sometimes they lose that humanity aspect. They forget what it was like to be a student and to be tired and broke and lonely and stressed, and to feel like their needs aren't being met, or that their emotional needs aren't being addressed. So I definitely can see that. And what I would encourage you, or what I can tell you, and this is the same thing I'll tell my son when he has issues with his teachers too, I can't control them. And the only thing I can control is myself and my response to them. So if there's a professor that is not giving you what you need, seek out other resources. If your advisor is making you feel less than, or is making you,
or like they don't have time for you.
They don't have time for you, or they cancel appointments with you, or they tell you this is just should be easy for you. It's not easy for anyone. And if someone's making it look easy, I guarantee you they're up all night studying and cramming and doing everything that they can. So nursing school in and of itself is not easy. But instead of focusing on, I'm not getting what I need from this professor, they're not teaching me in the way that I can understand, there's nothing you can do about that. There is no way that you can go and change his or her heart and make them find their love for teaching again and have them present things in a way that you understand. So go find those resources and those places where you do find what you need. We're really trying to create a community here where you can bring your concerns and you can message us on our page, or you can email us, you can do whatever it is that you need to do to say, hey, here's my situation and here's what I'm struggling with, and we can kind of help you navigate through that. So we're definitely a sounding board, and understand that the emotional part of nursing school is a huge, big deal, right? So the academic part is difficult, but if you're boohooing crying and you're losing your ever-loving shiat,
Is that the word we're
that's
using?
a better word. It's going to make it very difficult for you to learn and to perform on an exam. So what I would encourage you to do is to not focus on that negativity that you're getting from them. If you're not getting what you need from them, you're not getting what you need from them, right? So go find places where you can get that. We have tons of free videos on our YouTube channel where you can get teaching in a different and more dynamic way. Maybe you learn better from people jumping around all the time. That's me. I sweat my ever-living ass off every single session because I'm running around trying to make it fun, and I get really excited about like the liver and stuff like that.
I don't. The liver's not even that fun of an
I love
organ.
the liver. It does
Like if you're gonna get excited about something,
everything.
like let's talk about the heart or the lungs.
It does
or
everything.
something.
So I would say get rid of the negativity. Just stay away from that portion. I know you have to go to class and things like that. I get that. But go seek out those resources and those places where you can get what you need, because negativity will always feed negativity. So if you are trying to bang down their door and saying, hey, give me what you need, you're probably not going to get that. But there are definitely places that you can get what you need, and that's learning in a different environment or being taught in a way that's different, and getting that emotional support. Anything you want to add to that?
No.
Okay, I've nailed it.
nursing
I know.
sermon
I
up
am
here.
like sermoning
Yeah, this is
today.
like the third one. I
that's
like
my
it.
pulpit today.
Your pulpit today. It's your pulpit every
It's my
day.
pulpit every day. I like talking about stuff. So we'll have another full session kind of on that and how you can sort of bridge that gap. I understand, and that's basically, and what you're saying here too is it's going back to eating their young. Hey, it was hard for me. It should be hard for you too. I can't change that type of attitude, okay? But I can learn to kind of navigate around that and do the best I can around that kind of
And
thing.
I will say it's not every older nurse who eats their young. I think that it's more of a hospital culture. I'm lucky to work at an institution where that's not the case. And if there is a nurse who's eating their young, then it gets dealt with and it gets brought to their attention and to management's attention. I will say, though, we're a little bit harder on our newer grads because we want them to be good. And I say that as a nurse who cares about younger nurses and wants them to be successful. I'm not saying that as an educator, and that's kind of a completely different subject, but I'm saying that my first day on the unit, one of the nurse practitioners came up to me and she questioned me, what do I worry about with amiodarone and Zofran? And I was like, I know the heart goes thud thud.
You're like, I'm nailing it. I
Yeah.
deserve to be here.
And so she was like, come back to me with your answer in 20 minutes. And I was like, oh, okay, I don't know. And I went and sat in the corner and I was like, what to do, right? The answer is it prolongs your QT interval.
Doy.
Duh. But, I mean,
Just kidding.
she didn't say it to be mean. She didn't say it to be rude. She didn't say it to eat me. She wanted me to learn. She wanted me to be better. And as a result of her and others like her, I am better. And I am a successful nurse. For the most part.
So you are.
I am.
He's a badass. He is. He won't say that. I mean, he will say it after we get
I
off
like to
the
keep
camera.
myself humble.
You don't.
Okay, well,
but
if I say it, I feel like it.
so bottom line, you want somebody who's going to push you, but yes, you don't want somebody who's going to destroy you. And I feel like, unfortunately, that's part of nursing school culture right now, because we're seeing it across all of our students all across the U.S., where they're feeling defeated and they're getting yelled at. And now there are some professors that are amazing, so I don't want you to think that we're saying that they're not. But you're going to kind of encounter that when you get into the hospital too. So it's really important that you find a way to navigate around it. There's going to be some nurses that are really, really mean and that you cannot change. There's going to be some hospital management that's like, oh, y'all are getting 1-ply toilet paper from here on out. And you're like,
God.
are you serious? I don't have time to like sit down and pee, much less wipe 482 times with 1-ply toilet paper. So those are some challenges that you're going to have to learn how to navigate around, and it can make people really bitter, or it can make them really better. And so we will do an entire thing on that, because I feel like that's a really deep subject that we could go into for like 100 years.
Oh, absolutely.
Yeah. All right, so back to study tips. So we talked to you about kind of how to study.
We're, like, all over
I
the
don't
place
even
today.
know. It's just, this is going, so I'm just so happy and I want to talk about stuff. Okay, so we're gonna go back to, we did some study tips, right? We talked about some what to do before your exam. So make sure that you're eating and sleeping. Y'all, if I hear anybody or see anybody post, pulled an all-nighter last night, I'm gonna throat punch you. Okay, don't do that.
She's not kidding.
I'm really not kidding. Let's talk quickly about recovery between semesters. Okay, here's what you're gonna want to do: binge watch Netflix for 3 weeks at a time.
Yeah.
Here's how that's not super helpful. I mean, I would do it for a good 3 days. I want that little message to come over. It's like, Netflix wants to know if you're still watching The Office.
Yes, obviously. Well,
Come
not The
on.
Office. Not The Office.
Oh,
But,
come on. Anyway.
fun fact, HBO does not have that.
Oh, does not have The Office?
Well, no, it doesn't have that little, are you still watching thing?
Oh, because it knows.
Because I fell asleep watching Westworld one time, and I woke up 7 episodes later, and I was like, what's happening? I'm in a new season. I don't know.
Oh, God bless.
But
well, Netflix does that and it shames you publicly, but
It
that's
does.
fine.
It's
It's
like
just
every,
like, are you
like,
still
2
watching
episodes.
this? Yes, I know it's been 8 hours. Okay, I know.
I know that I haven't moved, and I'm probably developing a pressure injury.
Yeah.
But
So after your finals are over, okay, so your adrenals have been like overproducing cortisol and your stress response, and to be quite honest with you, it can make you very fat, very overweight, very tired, high blood pressure. You're going to feel like a disastrous mess. So if we can't settle down those adrenals between semesters, you're going to get adrenal fatigue and you're going to feel like absolute freaking garbage because your stress response is going to be going all the time. You're going to feel depressed because we know that cortisol is decreasing the serotonin, right? So it is very, very important that you take a break, but a break does not mean like zoning out your brain for 2 weeks straight, because that really isn't going to do you a whole lot of good.
Nope.
Okay. But I would do that at least for a couple of days. When you say
oh yeah, at least
a good
48,
24 to
72 hours.
At least.
At least.
To zone out and to do something that is just like not something where your brain doesn't have to be engaged and you can just literally like sit.
Yeah.
Eat something that you don't even have to chew, like mashed potatoes and gravy.
What the
What?
fuck?
I'm hungry. I'm telling you, I have not eaten as much as I should have today. I was hungry. Okay.
Okay.
So, you just want to sit
So
and relax.
binge out for a few days, watch
Yeah.
Netflix, watch HBO, watch Hulu, whatever. And what I used to do is go home and like have, because I went to nursing school away from my family, I would go home and like have a dinner with your family. Like,
that's nice.
have dad grill steaks, have a glass, aka bottle of wine, like whatever.
You took it too far. Anyhow.
Why I have liver problems.
I know. Y'all do not want to see his ALT and AST.
They're not that bad, okay?
It was bad.
It was
Anyway.
not. Seen worse.
Time with your family, super important. If you can go home, like if you're at nursing school and you're somewhere where you've been away from your family, which is another challenge and is very, very
You're away
depleting.
from that support group,
Yeah, go home and just spend some time with your family if that does it for you. Like if your family is drama mama, don't touch it.
Stay in nursing school, be like, oh my god, I got so much to do, I can't come home.
Yeah, I'd be like, oh,
Netflix
Mom,
is still playing.
still
like,
in finals. You've been in finals for 3 years. Yeah, I know. I'm going to pass one time.
Yeah, nursing's hard. Like,
But family time is super important, even if it's just your family at home, you know?
Yeah. Or your family friends. Like,
Yeah.
your friend group can be your family.
Sure.
Especially if you're a long ways away from your home.
Absolutely. And I feel like, too, the nursing mamas or the nursing daddies, now is the time between semesters to fill your kid's love tank. Because they're going to be feeling it, and it really depends on the age of the kid how well they deal with mommy or daddy being gone in nursing school. The little bitty ones have a very, very hard time because they can't understand it and they don't know that you're working toward a goal. The older kids, like school-age kids, even some, I would say like the older preschool-age kids, you can really get them involved and invested. Hey, mommy's working toward this goal, and hey, I'm studying, and give them some note cards that they can work on, you know? Getting them involved is really helpful.
God, that could be a whole video in and of itself is for nursing parents.
Yeah, we'll definitely do that because I know I responded to somebody on our page that was talking about being a single mom and how she wanted to do all of the, you know, relaxation, or there was something that we had posted and she was like, I wish I could do that, but I'm a single mom. And we know that that is really, really difficult. So yeah, I think we should do something on that to kind of help support you guys and figure out what we can do to help. But being in nursing school and having kids is just hard. And they can go a period of time being absent from mom or dad or not seeing you as much, but you've got to use that time between semesters to really fill up that love tank and go places and snuggle. And mommy's off for a short period of time and we're going to go do this, or we can just sit at home and watch movies. Even just that time together, that is the time to make sure that your kid's love tank is full. So that way when you start the next semester, you're ready to rock and roll and they're not feeling that, they're not starting off already depleted. But what is most important, and this is the most important thing I wanted to say for this video, is you have got to take care of you first. Whenever I went in a plane, before I was a mom, when they were talking about like putting the mask on yourself first, I thought they were the most selfish human beings on the planet. I was like, I will definitely put this on my kids first. But then I realized like, hey, I'd probably be dead by the time like I wrestled my 3-year-old and 9-year-old with some oxygen mask. You know, like it's not.
God.
Yeah, and like I'm trying to fix it.
Like, I
and
had
I'm
to
trying
reach
to
up
like.
from the row behind you, like.
So I was like,
put on your mask.
So I didn't understand that whole like, oh hey, I would grab it, and hey, I would do like how I, I didn't get it. But filling yourself up first is the most important, because you will have nothing to give your kids or your spouse or your boyfriend or your girlfriend or your partner or whoever it is if you are completely depleted. Nursing school is not the time to be selfless, okay? I cannot stress that enough. Whether you're a mom, a single mom, a dad, just a nursing student, it's not the time to worry about other people's opinions of you. It's not the time to say like, oh, I've got to go spend time with my mom or she's going to be super upset. Mama can be upset because there is a period of time in your life that you have got to explain to your family, to your friends, whoever it is, this is my time to shine. And if I do not dedicate my whole entire self during this period of time, I'm not going to make it. And people that love you will understand that if you have that difficult conversation. But, it may be really hard for you because your boyfriend may be like, oh, let me take you out on a date. All I want to do is cry in the bathtub with a glass of wine and some chocolate. And explaining those needs and saying, I care about you and thank you so much for planning this, but I really just need to curl in the fetal position in a corner for a short period of time. You got to be able to verbalize your needs and take care of you. What do you think?
Yeah.
Yes. Yeah. I'm preaching it again.
17th nurse sermon of the day.
I can't help it. I'm excited.
I know.
Okay,
you are. It's good.
So it is important for you to take care of you so that can spill over onto other people. So taking the time to take a hot bath, even if it's a short period of time. Because if you got kids, you're not going to get a ton of time to go and have a spa day. But you may be able to take a hot bath. Or tell your husband or your partner or your boyfriend or whatever, take these children out to the park for a period of time. Mommy needs an hour to take a nap. Okay, but if you don't verbalize your needs, you cannot get upset with people for not meeting them. So it is important for you to fill yourself up so that you can then spill over into your kids or your mom or your family or whoever it is that's around you, and then fill them up after you're filled during your break time before you get ready for next semester. Now, some of you may only have, a week or 6 days or 2 weeks in between sessions. So you need to get on this like yesterday. Exercise, get moving, treat your body right. Because if you abuse your body and then you're studying on how to help people who abuse their body, the universe is going to get a little bit confused. Okay, so that is the time to get up, get moving, decrease those stress levels,
so
let your adrenal glands settle down for a hot minute, okay, and then move forward. Chris Johnson said wine. Oh,
yes, all the wine.
You're speaking Jared's love language right now.
Yes. There's actually a 6th love language, and it's wine.
And that's his. Do you guys have a video on how to do dosage calc in peds? God, no, but I can do one. Nobody likes that topic, so I would have to be the one that does it.
Good luck.
But that's a good idea.
This is why I do adults, just for that whole reason.
Okay, Jennifer says, I am a mother of 2, husband works nights, close family member just diagnosed with stage 4 lymphoma and other outside stressors plus nursing school, so I definitely need the positive reinforcement. Jennifer, girl, that's tough.
You got a plate full.
You got a plate full. But I feel that students that have those kind of things going on during nursing school have the most blessed reward when they finish. So I feel like the world knows how much you're up against, and they will see that. And I don't know how to explain it. I just feel like the students, and I've seen it happen over and over again, which is why I'm saying this, I'm not just lying. The students who have been up against the most, and that day that they finish, it is a glorious day. Not saying that everybody else doesn't have a great graduation. You're going to have a great nursing school graduation. But it will be so much sweeter, and you will appreciate the process so much more. Not while you're in it, because it's going to suck.
You're going to hate every second of it.
But when you look back, you're going to look and see like, man, I cannot believe I did it. And people will ask you, how did you do that? You'll say, I have absolutely no idea. But every day I woke up and I just did it that day. And then I woke up the next day and I did it that day.
Take it one day at a time.
You'll look back and holy crap, I cannot believe I accomplished this thing. Mm-hmm. Okay?
Amen.
Okay, so surviving between semesters, get your body healthy. Y'all eat a freaking salad, okay? Because I remember at nursing school, I survived on Taco Bell. Oh my God.
Taco Bell and Whataburger.
Oh, it was so good. And you're right. And I like how you said, like, anytime I was even, like, moderately hungry. Yeah.
Yeah, because
I
it was
would
an excuse
either-
for me to leave my computer, leave my books.
I'm just gonna take a break for a minute.
And you know what? Oh, I could drive
42
through, or I
tacos
could just
later.
I could just park here and eat here. That way I could spend later. And then, here's the worst part: is I would come back and be like, you know what? Let me watch an hour-long episode of Netflix while I eat, and the eating takes me 10 minutes, and so then I would waste an hour and a half, like going to get the food, coming back, and like what?
And then you'd be like, oh, that was a great distraction.
Mm-hmm.
Meanwhile, you're so full.
Cliffhanger. Next episode.
Tacos are coming out your eyeballs.
What is it with you and
I
out of your
love
eyeballs?
tacos.
You have a problem with food today.
I know, I'm really
We're
hungry.
gonna eat after this.
Ooh, that sounds really good.
I know.
Yeah,
We're gonna figure that out in a second.
Okay, I will not eat Taco Bell. I gave that up for Lent.
Life?
Yeah.
Lent ended.
After I literally ate so much Taco Bell, I just can't do that to myself anymore. Anyhow, so bottom line is, you're gonna gain weight in nursing school. That's pretty natural. Even if you have good eating habits, because your cortisol is producing and you're going into fight or flight, and your instructors are yelling at you, and you're stressed about the exams. You're in this chronic stress response. What I always tell students, don't worry about the weight gain while you're in nursing school. Like, do the best you can. I'm not saying go ham and eat literally an entire ham. Don't do that. But you're going to gain a little bit of weight. But what I always tell them is, you will lose it in the first year because you will be running your absolute ass off.
You're not going to know what you need, or you're not going to know where to go.
You're going to be like, I'm going to go start an IV, and then you get in there and you're like, I don't have any catheters, and then you're going to run out and then come back and get it, and then you're like, okay, I'm ready.
Flushes.
Yeah, and then I gotta run again. My time management skills were so garbagey. I lost
30,000 steps a day.
1.5 million pounds. All that Taco Bell just melted
For
right
me,
off.
it was night shift. Like, once I moved to night shift, then I lost all the weight.
Me too, because there was never a good time to eat. I would wake up at 4 o'clock in the afternoon and be like, oh, it feels weird and I'm weird. So I didn't want to eat 4 o'clock. I didn't want to eat. So then I'd get on the unit and my time management was so bad I didn't have time to eat till 4 a.m. And then I was like, well, by that time I got to do my last rounds.
Yeah, and I used to drink coffee all night at work, and so then I was just never hungry.
So, bottom line is, the weight will come off, so don't stress about it. Just wear some yoga pants for all the nursing school. You got scrubs. They're basically big potato sacks anyway.
Yes.
So you're fine, okay? Do the best you can. Treat your body the best that you can. Just know it will come off because your time management will be awful. And that's normal, and it is natural. And that's the way that God created it, so that you would lose a nursing school weight, okay?
Exactly.
So do not panic about that, okay? So just do the best you can.
Yeah, you are not going to have time to play cards on the unit, I promise. Sorry.
That's a whole nother session.
I had to sneak that in there.
Okay, I knew that was coming. I was just waiting for somebody to say something. Yeah. So it'll come off. Don't worry about it. Do the best you can, though, and stop feeding yourself total and complete garbage because you will feel like total and complete garbage.
Absolutely.
Okay? Even if it's small things like trying apples and peanut butter, anything you can do to increase your protein and take in less rapid sugar. Now, I was the queen of Red Bull when I was in nursing school, but I never slept because I would drink it all day until I had to stop studying, and then surprise, my body didn't want to sleep at nighttime, and then I was sleep deprived and I was miserable.
See, my problem is that I would drink coffee until 2 o'clock in the afternoon. Can't drink coffee anymore. I'm done. So then I take a caffeine pill.
Yeah. Okay. Don't do that.
I do not.
This is an example of what not
1,000%
to
do not recommend caffeine pills.
Yeah.
At one point, I would go to night shift and I would take, when I was in nursing school, I did night shift and I would take a caffeine pill and drink it with my coffee.
And then his heart exploded.
Yep.
And the only reason he's here is because I put him back together. Okay?
Yeah.
Don't do that.
Do not recommend.
It feels good while you're doing it, don't get me wrong. I would take all kinds of stimulant things like Red Bull and, Monster, whatever it is. And I'd be like, man, I'm rocking this clinical. And then I'd get home 14 hours later and be like, I'm also not ever sleeping. So it just really, really is harmful for your body. So, I know y'all are probably going to take 0.1% of the health food advice. But what I can tell
if you want a health food advice that gives you a lot of protein and makes you feel good, cook a steak.
There you go.
Everybody likes steak.
There you go.
Unless you're vegan or
you're going to have all these PETA people protesting you.
This is Texas. We like steak. I'm
But
sorry.
they're from everywhere. Okay, so bottom line is treat your body well, okay? Take your break during nursing school. Spend time with your family. Veg out for a couple days. Always veg out for a couple days and do whatever makes you feel fantastic. The other big thing I'll tell you is to get your body out in nature and breathe in some trees, okay? Being in nature makes you feel better. There's tons of research that shows that it clears your mind and it helps you to really get focused on you. I cannot stress to you enough how important it is to refocus yourself before you restart the semester, because if you start with depleted resources, you're going to be depleted super ridiculously quickly.
Mm-hmm.
Right? They want a video on time management skills. Yeah, we could do that. That'd be fun.
Okay.
Ooh, I'm going to preach
this
it.
This is going to be an interactive video, and y'all have to do things for
Yeah,
us.
you have to do stuff. Like, not eat Pop-Tarts, but we'll make you do stuff.
We'll send you to the grocery store with a list of things on opposite sides of the grocery store, and you have to get one after the other, and you just run back and
Oh,
forth.
we could do like a what was that supermarket game that they used to play where they would give you a list, and then you'd have to go and get it and see who could get it the fastest. Yeah,
that's pretty much all of nursing, is that you literally
you go to
your patient's room
the fastest.
and then realize that you, for some reason, it didn't pull up in the Pyxis, and so you didn't pull this one med, so you got to go pick it up. Oh wait, it's not in that Pyxis, it's in the other Pyxis. So then you got to go there, and you get it all the way back to your room, and you're like, oh, I haven't crushed it, so you got to go all the way back to crush it, and that's nursing.
You'll be running a lot,
that's
like
all
a lot,
nursing.
Until you learn like exactly what you need and when you need it.
Yeah.
So if you're looking at how to de-stress and decompress and rebuild yourself and fill yourself up and fill your kids up and fill your partners up during this break time, you can take one of two ways. You can go this hippie way with me, where I'm like an essential oil sniffing, loving the tree and hugging it way, or you can just drink wine and watch HBO on demand.
You make me seem like an alcoholic.
No, I'm saying either way would work great.
Mm-hmm.
You pick your way.
Alcoholism is
One
not
way
okay.
causes elevated liver enzymes. One way causes increased cerebral perfusion. So you choose which one you want.
Hypertension.
There actually is a place for wine.
Will increase
I know.
your cerebral-
There actually is a place for wine. I feel like it's
Yeah.
important not overdoing it, but having a glass of wine at nighttime has shown to have cardiovascular benefits.
I have a glass of wine. Bottles are a glass. There you go.
That's not a glass. We'll talk later. Okay. But if there's any questions you guys have, we're about to wrap up the session. So if you have any big questions, if we haven't addressed them already, better hit us with them. Like super quick. Stacy said wine and tree love. Oils too.
Yes,
See?
there is a combination.
Okay, there probably is like a baby of ours somewhere that connects those two things. Don't get upset about it. It's just a little love child that likes hippies and wine.
Yes.
Okay.
Yes.
So if you have any other big questions, hit us with it. Wendy said best tutoring place ever. Thank you, girl.
Thank
She
you.
graduated and she is out there doing her thing. So
Saving lives.
Really proud of you, Wendy. Chris Johnson said a large glass of wine filled to the top. You're his kind of people. Yep.
Yeah, I'm right here.
Yep. Filled
be
to
at
the
the bar
top.
later.
And then once he takes a sip, he's like, fill me up. Yes.
Yeah, fill up the rest of the
Right
glass.
here. Right
This
here.
is my tasting.
Yeah. All right, so we're going to wrap up for today. I hope this was helpful for you. I hope you got some insight that will help you. Please be sure to share the video with your friends or in your nursing school group so that they can get some insight on how to get through finals too. Oh, my thing went away, so I don't even know what you guys are saying. The other thing I want to leave you with is to make sure that if there are some video topics you guys want to hear from us about, we're about to start doing weekly videos and getting out there. So either message us or you can comment on the video and let us know big topics that you're really interested in hearing about, and we'll prepare something for you and have these nice, beautiful chats without the F word.
It was one time.
It was one time.
Yeah, that's way better
so we
than
can
my
help
average.
you
I want
and
you to know.
guide you through nursing school. All right, so take home points. I want you to remember we're going to be posting our blank disease templates for you so you can use those to study if they work for you. But fun fact, they work for everyone. They work really, really well if you use them correctly. So we will post that for you so that you have it. Other take-home points. Share the video. Share it with all of the nursing school friends that you have, because I feel like we talked about a lot of really valuable things today, and it wasn't even what I planned on talking about. I wrote an outline. I didn't even look at my outline.
And I want to make the point that a lot of this stress-reducing, self-care stuff still applies once you're an actual nurse, because some days where you work 3 days in a row, you're off one, you're back for 3, and at the end of it, you're just like, I don't even know, is the sun arisen yet? Like, is it morning? Is it night? Who's the president? Like, you're asking your patient these questions and you don't even know the answers to them, right? These topics and these self-care tips still apply to you as a person, as a nurse.
That's a really good point. Because once you graduate, it does get harder for a period of time. That first year out of nursing school is really, really tough.
You feel kind of like a failure.
Yeah.
I don't mean to say that in a negative way.
I don't know anything.
But they'll ask you a question in rounds or something, or the doctor will come by and like, well, what was this? And be like,
I don't know.
Not sure.
Just give yourself some grace, okay? And know that it's going to be hard for the next period of time, but that it is definitely worth it in the end. When you walk onto the unit, do you automatically feel like, oh my God, I'm going to murder everyone?
No.
It takes you about a year to feel that way, where I confidently walked onto the unit and was like, okay, I'm not going to murder a kid today. I got this. I kind of know what I'm doing. I got my flow. Okay.
And it takes that long for you to build that trust in yourself and that trust in your team, right? That team trust and that team work is so important to surviving and to care for your patients.
For sure. All right. Jake and Sarah said, why was this so much more enjoyable to watch for an hour and 15 minutes than listening to a lecture for an hour and 15 minutes? It went by really fast.
I know. Hour and
When
15.
we were
You sat
preparing
down for
for
this
this-
for 30 minutes?
Yeah, okay, I lied to you, to be completely honest.
I figured.
So I had to talk him into doing this video because he's nervous about live videos, right?
I just don't do live videos that often.
I do them all the time, so I was trying to incorporate. Anyway, so he's like, how long is this going to be? Like 15 minutes? And my mind knew this is an hour and a half video. Like I already knew it was going to end up being that way. And I was like, no, it's probably going to be like 30 minutes or something. It'll go by fast.
Yeah, when it took us 20 minutes to get on to like the first part, I was like, oh yeah, it's going to take a while.
Now you know. Sorry, I told
It's
lies.
okay.
But it was for
I
a
realized
good
that
reason.
a long time ago.
It was for a good reason. Anyway, all right. Well, thank you guys so much for being on with us today. Feel free to message us any questions or concerns or comment on the video if you have any major video topics. Oh, you want to come in the video? We're just about to end. So Julie's here. She just walked in from her amazing new job at MD Anderson.
Yes.
We're just wrapping up. I told Jared it's going to be a 30-minute video. We've been on for an hour and 15.
Well, that's fun.
But I preached today. Do you want to introduce yourself really quick?
Hi, I'm Julie. I'm a former student here at Ivy League. I take on most of the Adult 1 courses, some of the psych classes. I'm all around. I do the ATI, the HESIs, the Ts, kind of one size fits all.
Yeah, she does a lot of tutoring sessions for us. She's an Ivy League graduate. She's got an amazing RN job out there doing cancer research, which is super cool.
Right.
And
do that
there's
as a
something
new
else I was
grad,
going to
though.
ask you to tell people, and I forgot what it was already. Oh, so we were talking about how we're going to be doing kind of weekly videos, and each one of us can take something. Do you want to say for just a second what your videos are going to kind
I'm
of
going
be
to
based
do
on?
new nurse stuff. Like, since I'm a brand new nurse, my stuff is going to be geared towards those of you just coming in, those of you who are in residency things. It may be like, I had a really bad day because I didn't know how to handle X, Y, or Z. Or if there's any topics, like as a new nurse, that you're facing that you may not know how to handle and you want me to talk about, and we can talk about them together, brainstorm, like some ideas, I'd love to hear them.
Yeah, so we'll be having, Jared's going to be doing
The hot topics in nursing. So we're
hot
definitely-
topics. The hot topics in nursing. Because you said it like that. You go, I'm going to be doing the hot topics in nursing. So he'll be doing like the big, obviously we're going to talk about card games. Like that's going to
The
come
card
up.
games comment, the
That-
nurse who pushed vecuronium instead of her said, those kinds of things.
Mm-hmm.
And
Julie's
I will
gonna
have
be
a glass of
doing
wine, don't you worry.
New nurse, kind of like a new
Yeah.
nurse
New nurse
university
news.
orientation or something,
Yeah.
to kind of walk you through the transition, because there's really nobody out there who's walking you through, okay, I graduated, now how do I become an actual
How do I become
nurse
independent?
without murdering anyone?
Yeah.
Okay,
Right.
so she's there to help you kind of bridge the gap and walking through like the orientation things and things like that. And then I'm obviously just going to be preaching. Like that is my spiritual gift. So I'll be preaching to you.
I'm going to get you a little podium.
Yeah.
Yeah.
I will stand on the podium and I will tell you things you
Little
need to
platform
know.
and everything.
I'd have to do the spiritual side.
Yeah.
I want to
get you a spirit
do the
stick.
touchy-feely side. Sorry, I know that's not for you.
It's not.
Anyhow, all right, so we're going to wrap up for today. Thank you guys for being with us. Share the video with other people so that they can get preached to today also, because everybody needs a little bit of
Everybody needs
Jesus
some
and some
Jesus.
curse words, apparently.
I said like 2.
He said like a bunch.
Did not.
Anyway, all right, you guys have a
Lies.
good day. Go study hard,
right.
and we will see you very soon, I guess, next
Yes.
week sometime.
All
Okay.
right.
Wait.
Oh, God. Are you okay?
No, hold me.
Patient fell on the ground.
Ah!